Some of the factors that go into that you have drugs and technology. One of the arguments is that our drug companies, our drug prices are so high because we bring most of the drugs on the market throughout the world. However, pharmaceutical companies based in other countries bring drugs to the market. One of the things that we have in America that they don't have in other countries is marketing. Pharmaceutical companies spend more on marketing than they do on research and development. They spend 3 to 4 times as much on administrative expenses and marketing than what they do on research and development. Another one up there is government mandates and regulation. There's almost 1,900 regulations and mandates on health insurance coverage across the country. You have 50 different states with 50 different sets of rules that the health insurance company that's marketing their product has to meet. That takes staff in each one of those states. Not all of the insurers operate in each state because of the amount of money that it takes to sit there and wend the way through in order for them to stay legal. The other one is litigation and risk management. Lawsuits. I was really upset about the fact that the Obamacare didn't do anything about tort reform. Because that is part of driving the cost. However, I've changed my mind because of my experience, recent experiences over the past year. Lawsuits offer the only check and balance that the consumer of health care has in this country. Until there is fundamental change in the payment and delivery systems in America in health care, I'm all for more lawyers. And for people that know me, they know that's not me. But my experience has now driven me to the opposite point of view. Increased consumer demand. We're blaming the consumer for the latest and the greatest. And what drives consumer demand? It is the marketing. We know marketing works. Otherwise, all of the major corporations in the world would not have marketing departments. We know marketing works because we stopped advertising tobacco products in this country because we know that it influences consumer choice. And anybody that's sitting here, if they have a condition that needs to be treated, if they see it on TV, and if they are in pain, they're going to demand the latest and the greatest. Yet they're at fault for demanding. So is it personal choice? Is it really personal choice? We keep hearing those words bandied about. The other thing I needed to talk about is technology. We are addicted to technology in this country. And
now you're better.
And including medical technology. One of the things about technology is in the 20th century, lifespan increased approximately 30 years. Medical advances in technology contributed to 5 of those years, approximately. The other 25 are the result of public health initiatives like clean water, good nutrition, adequate housing, entitlements. Now, this might get a little bit dry here, but there are other public policies that influence healthcare in other countries. And these are all I keep getting my head in the way. Sometimes my mouth gets in the way too. These are all interrelated. Very, very, they're complex, and I'm trying to bring it, I'm trying to place it in something that's somewhat understandable. So on those cards, I'd like some feedback on whether or not you get kind of a picture. And now I'm behind on my notes. At the top, you have some big words: macroeconomic and employment policies. I put some examples of macroeconomic policies at the government level. One of them is taxation, which is a method of redistributing wealth. Another one is monetary policy, and that's in the arcane world of the Federal Reserve. Inflation, the Federal Reserve, our economy is built on the fact that we're going to have inflation every year. The target inflation rate that's set by the Federal Reserve is 2 to 2.5% is what they want it to be. What that means is every year, if it's 3% and you have a product that you want to sell for $1, you can sell it for $1 at the beginning of the year. But if you sell it for $1 at the end of the year, you're only getting 97 cents for it. So you have to increase your price each year just to stay even with inflation. Free trade agreements are another macroeconomic policy. And free trade agreements also influence employment. And employment policies, we have a minimum wage policy in this country, but we don't talk about living wage. Now, from this top picture, everything else flows down, because without jobs, you don't have money to support the social programs, to support health care, to feed to heal the sick, to feed the hungry. So example of income support policies is the Earned Income Tax Credit. Supplementary Social Security income and disability income. Under welfare, you have food share, or food stamps. And in our I can't say that. In the drive for welfare to work, which many times is putting people in minimum wage jobs, we had to increase child care. Because you can't go to a minimum wage job and be able to pay child care. So we have the welfare to work programs, and now we've had to increase child care. Now, if you cut welfare, you're going to increase health care expenses, because now more and more people, and Medicaid is part of a welfare program, more and more people are not going to afford themselves of preventative medicine. They're going to wait until something really drastic happens. They can't be denied care at the emergency room, but they're going to have much more work done at a much higher cost. So there's a relationship there between both welfare and income support policies. Education. Education policy is a key in this, and it slices a couple of ways. First of all, in this country, if you want to be a doctor, you're going to come out of there with maybe hundreds of thousands of student loan debt. In some other countries, you have no debt. So when you come out of medical school and go into practice in this country, you have to get more dollars than what somebody whose education has been paid for. That's a portion of the higher cost of our healthcare system. Education also influences how the choices people make. Lifestyle choices. Education is, this whole circle. Can you start to see some of the interrelationships between this? And this one is also a hot button issue. Civil rights policy. That also includes immigration policy. But one of the things about the role of government comes from the Declaration of Independence, and all people are created equal and have the right to the pursuit of liberty, and however it goes. And the next line in that says, government was instituted by men to promote equality